Hello everyone, this is Suprava. Welcome back to another session with me. In today's session, we will be discussing about convulsion disorder. So this is basically a neurological disorder, and when we would talk about convulsion disorder, there are also other two terms which comes with it, which is epilepsy and seizure. Now, all these three terms, which is convulsion and epilepsy and seizure, all these three terms are related. And what we can see in all these three things would be there would be a sudden disturbance in the neurological function, and that would be caused by an abnormal or excessive neuronal discharge. Now, what we mean by abnormal or excessive neuronal discharge, that we would discuss in later slides. Well, so if we talk about epilepsy, it is actually a seizure disorder. So you might be thinking, what is seizure, right? So seizure is defined by abnormal electrical discharge from the brain. Now you know that there are there are neurons which sends electrical signals, right? So when there is abnormal electrical discharges from those neurons from our brains, what happens is known as seizure. Right, so that is what is called as seizure. Now, when there is this episode, or when this event occurs, we call it as seizure. So when there is recurrent or unpredictable seizures, when there is recurrent seizures, we call it as epilepsy. So basically, when in epilepsy, we can see that there would be recurrent symptoms, right? This seizure episode would happen over and over again. Well, so to understand it in a more better way, let us move on to the definition of epilepsy. So epilepsy can be defined as a sudden, recurring, synchronous and involuntary series of action which occurs due to abnormal electrical discharge from the brain. So in the definition, we can see a lot of words, right? The first thing is that it is a sudden event, right? So we cannot predict when a child or when a patient would get a seizure attack. It is unpredictable. It is a sudden event. Also, it would be recurring. So there would be recurring, episodes of seizure, and also there would be, it is synchronous. Now, what do we mean by synchronous? So we know that our neurons get activated and it sends electrical signals, right? And that is how the normal process is. But we know here that there would be abnormal electrical discharges, right? So here synchronous means, active at the same time. That means all the neurons would be synchronously active. That means all the neurons would be active at the same time when it is not supposed to be. And because of all these things, the person would have involuntary series of action, involuntary movements. And this occurs due to abnormal electrical discharge from the brain. So what is this abnormal electrical discharge and how does it happen? That we will learn now. So to understand or to learn about the abnormal electrical discharge, we have to look at the neurons, right? Because that's where the problem is. So now if we look at the neuron, we can find that there are neurotransmitters, right? So I hope you are aware that there are neurotransmitters which bind to a receptor and tell the cells when to, send the electrical discharge or when to stop the electrical discharge. Now here I mentioned two things that there are neurotransmitters which actually bind to the receptors and tell the cells when to, send the electrical signals, right? When actually to release the electrical signals. Likewise, there are also neurotransmitters which bind to the receptors to and tell the cells when to stop the electrical signals or when to stop sending the electrical signals. So we understood that there are basically two types or two kinds of neurotransmitters. The first one, which is actually which actually release the electrical signals or the discharge, we call it as excitatory neurons. And the other one, which actually stop the electrical signals, that is inhibitory neurons. So in a healthy brain, what happens? These excitatory neurons and these inhibitory neurons, they work together and there is well balance in between these two. But for example, imagine if there is any impaired neuron among these, two types of neuron. If there is any impaired neuron, then what would happen? It would start sending sudden excitatory signals over and over again. Now the question is why it would start sending these excitatory signals over and over again, right? And how this would happen. So the first thing is that it can happen due to two reasons, right? Either if there is too much excitation, and the second thing is if there is too little inhibition. So we learned that there is excitatory neurons and inhibitory neurons, right? So when there is excitation, like how the neurons would release the electrical signals, likewise there are neurotransmitters which actually tells the cells when to stop sending these electrical signals, right? Now imagine if one of these two mechanism is not happening properly. So what would happen? Right now, if there is too much excitation or too much the excitatory neurons are overactive, it is working overly, then what would happen? The inhibition would be too little compared to that, right? And because of that, there would be sudden excitatory signals. And apart from that, again, if the excitatory neurons are working properly, the excitation is proper, but the inhibition is not happening properly, or the inhibitory neurons are not working properly, then again the result would be same. So here basically two major things, that is excitatory neurons and inhibitory neurons, right? So in our excitatory neurons, we have neurotransmitter which is known as glutamate that actually bind to the receptor, and it tells the cells when to start sending the electrical signals, or it actually release the electrical signals. And for our inhibitory neurons, we have a neurotransmitter which is GABA, which actually bind to the cells and bind to the receptors and tell the cells when to stop sending the electrical signals. Well, so we understood, how does this happen or why it happens, right? Now, seizure means actually that there is abnormal electrical discharge, right? There might be one episode. And then again, epilepsy means actually it is a seizure disorder where there would be recurrent symptoms, recurrent seizure episode, right? So when it is happening for two or more times, so we can call it as epilepsy. Well, so we understood how these neurons are responsible in sending the electrical or abnormal electrical signals, right? Now, let us move on to the causes to understand why why there might be impaired neuron, right? Or in which all cases there might be seizure. So first we would discuss about neonates, as we are discussing about pediatric patients here. So first we would see in neonates what might be the cause. Well, the first thing would be hypoxia. So if there is, lack of oxygen, if there is hypoxia, then definitely there might be, abnormal electrical discharge, there might be seizure episode. And also if there is birth asphyxia or electrolyte imbalance, for example, if there is hypoglycemia or hypocalcemia, in that case also there might be seizure. And the next thing can be narcotic drugs withdrawal. So sometimes to treat other diseases, we give narcotic drugs to the neonates, and when we start withdrawing the drug, as a result of withdrawal of these the narcotic drugs, there might be seizure episode. Also, if there is septicemia or if there is congenital malformation, if there is, for example, spina bifida or any sort of congenital malformation which actually involves the central nervous system, again there might be a chance that the child will have seizure. And then there is torch infection in the mother. So if there is torch infection in the mother, for example, like toxoplasmosis or rubella or cytomegalovirus or herpes simplex. So these infections, if these infections are there or any kind of other infections, then again that might cause harm to the child and the child might have seizure. Next, let us discuss about the causes for infants and young children. So, for infants and young children, there might be meningitis, or there might be encephalitis, or if there is any kind of central nervous system infection, or sometimes if there is drug intoxication or drug withdrawal. So as I mentioned for neonates also, that we give sometimes narcotic drugs, right, to treat other diseases if there are any other problems. And when we start withdrawing the drug, as a result of this withdrawal of the drug, there might be seizure. Then if there is acute head trauma, so anything which can actually cause harm to the neurons. So if there is acute head trauma or traumatic brain injury, in that case also there is a chance, there is a possibility that the neurons might get affected, right? And if the neurons are impaired, we just learned that how it can send abnormal electrical discharge, right? And that's what is seizure is. Next, if there is any metabolic disorder, for example, if there is hypoglycemia or any sort of electrolyte imbalance, that can also cause seizure disorder. Next, if there is post-infection, so after the infection also there is a chance that might be the child has recovered from the infection, but post-infection is also a cause of seizure. And then if there is brain tumor, so brain tumor can also actually cause seizure. And also apart from all these things, if there is high fever in the child, that can also cause abnormal electrical discharge. Well, next let us move on to the stages of seizure. So in stages of seizure, we have the first stage is prodromal. Now this prodromal actually start days before a seizure happens, and here we can see prior symptoms. So the child might have depression or anxiety, or there might be gastrointestinal or urinary issues. So this is something which actually happens day before a seizure happens. The next stage or the second stage is aura. Now this happens at the very beginning of a seizure, and here the child will have altered vision or hearing. There might be a sudden weird taste or smell, and this happens within seconds or minutes. So here you have to remember that these experiences, or in this stage, especially in aura, different child will have different kind of experiences. So this you have to understand that what are the symptoms that your patient experience, right? So this is actually different for each patients. This might be experienced differently by different patients. The third one is ictus. Now, ictus means actual seizure. So, when the seizure attack happens, we call that phase or that stage as ictus. So, this lasts about 1 to 3 minutes, and if it is greater than 5 minutes, or if there is recurrent seizures which is happening and it is lasting about 5 minutes or more than 5 minutes, then it is called as status epilepticus. So this is basically a very severe form of epilepsy where we need immediate treatment. And the last one is post-ictus. So post-ictus is basically after the seizure, the recovery period basically. And here the child will be very tired, they would be confused, they won't remember about the event, and also the child might have headache, or sometimes you can find injury also, because during the seizure episode they might bite their tongue or cheek. So because of that there might be injury, or you can see blood from their mouth. Well, so these were the stages of seizure. Now let us move on to the types of seizure. So in types of seizure, we have actually majorly, we have two types of seizure, that is generalized and focal seizure, right? So generalized seizure is something where the whole brain is involved. It is not concentrated in only one particular part or particular lobe of the brain. Whereas if we talk about the focal seizure or partial seizure, there we can see that it is centralized in one particular part. Might be one hemisphere is involved, or might be it is only the one lobe of the brain is involved. It is not the whole brain is not involved. So in generalized seizure, we again have different types. The first one is tonic seizure. So in tonic seizure, basically you can see that the child will have body stiffening, right? So the muscles would become stiff, and that's what we can see in tonic seizure. The next one is clonic seizure, where we can see there would be recurrent jerking. And then we have tonic-clonic seizure, which is also called as grand mal seizure. So this is one of the most common types of seizure, and here as you can see that both the name are involved, that is tonic and clonic. That means both the characteristics would be involved here, right? That there would be body stiffening and also there would be recurrent jerking. Also, in tonic-clonic seizure, mostly the patients would have an aura, that is the second stage that we discussed in the stages of seizure, right? But again, the symptoms might vary from patient to patient, but mostly the patients who experience this tonic-clonic seizure, they would have this stage of aura, and then patient basically mostly the patient loses consciousness. Next, there is myoclonic seizure. In myoclonic seizure, there would be short muscle twitchiness. Next one is absence, so which is also known as petit mal seizure. So this is most common in pediatric patients, and you can see the child would be staring at you. This is mostly unnoticeable, like it goes unnoticed because you can't actually the child won't have any sort of symptoms, or like the symptoms that we discussed just now, that there would be jerky movements, there would be body stiffening. All these things would not happen. So that's the reason most of the time it goes unnoticed, and the child would stare at you. So it appears to be, as a child is daydreaming. The next one is atonic, which is also known as drop attacks. So we learned about tonic seizure, where we learned that there would be body stiffening, and that's the reason the child or the person would fall on their back, right? Here it is mentioned as atonic, right? That means it is just opposite to tonic seizure, right? So here there would be without muscle tone. The child would lose his muscle tone, and that's the reason they would with the most heaviest part of our body, that is our head, right? So the child would fall on their head, and that's the reason there might be head trauma. Next is focal seizure or partial seizure. So here we have basically two types, that is simple partial seizure and complex partial seizure. So in simple partial seizure, what happens, the child won't lose consciousness, the child would be conscious, and in complex partial seizure, the child would be, there would be impaired consciousness. Basically, the child would be unconscious. So next, let us move on to the diagnosis of this epilepsy or seizure disorder or convulsion disorder. So here, the first thing that we can do, we can do brain imaging, for example MRI or CT scan. That would tell us if there is any impaired neurons, or if there is any trauma to the head, or what is the cause, right? We can find out. Next is EEG, electroencephalogram. So this would also record the brain activity, and it would help us to understand whether it is a type of generalized seizure or focal seizure, right? And again, we can do blood examination. Now, why blood examination? In the causes we saw there are several causes which can actually be ruled out through blood examination, right? So we can do blood examination also to find out about the seizure disorder. Next, let us move on to the management of epilepsy. So here in management, first we would discuss about the medical management. Now in medical management, we can give phenytoin, which can be given as 50 mg per ml. So that can be given, and then we can also give barbiturate, that is that can be given at a rate of 2 to 3 mg per kg. We can also give phenobarbital, which is 3 to 5 gram. Apart from these, we can give sodium valproate 15 to 20 mg and carbamazepine. So this can be given 10 to 20 mg per kg. So these are the medications that are actually given to the child if they have epilepsy or convulsion disorder. Next, epilepsy surgery can be performed. So if there is, for example, if it is a kind of focal seizure and it is caused due to a particular part of the brain where the neurons are impaired, right? So that can be removed. Actually, the cause can be removed. So surgery can be done. Next, nerve stimulation can be given, which stimulate the vagus nerve, and that would, the vagus nerve would influence neurotransmitter to release. Next, we can also give ketogenic diet. So why ketogenic diet? Now, ketogenic diet is actually something which forces the body to burn fat, and it produces ketone bodies. Now, which actually can be used by the brain as energy instead of glucose. So that's the reason we can give ketogenic diet. Well, next let us move on to the nursing intervention. So in nursing intervention, the first thing that we would do as a nurse would be assessing the risk factors. So first we would assess the risk factors, and then our first priority of treatment would be to ensure an adequate airway, breathing and circulation. So you have to make sure that your patient or the child is having adequate airway, breathing and circulation. And then we have to assess their seizure history also, right? So you have to understand what are the signs and symptoms that your patient experiences, or the patient might tell that he experiences the aura phase, he experiences some kind of weird taste or smell, right? So before the seizure occurs, right? So that would also help you to understand what kind of seizure the child actually experienced, right? So you have to assess this seizure history. And then you have to make sure that the bed rails are padded, because during the seizure episode there is a high chance that the child might get injured, right? As there would be jerking, involuntary jerking movements that can harm the child, right? So that's the reason the bed rails should be padded, so that the child should not get harmed or injured. Also, as a nurse, it is always safe to to make the bed at lowest position, because there won't be any risk of falling down from the bed, right? So we don't want that, and that's the reason you have to make sure that the bed is not at a very high level. It should be at its lowest position. Also, make the patient lay down on his side, because so that whatever the saliva or is produced, that can be drained out, and also it would prevent the tongue from falling back. Also, you have to remember, which is very important during a seizure, you should not restrain the child, because that can harm the child. So you actually should not restrain the child. You should not do not insert anything in the mouth, and you have to remove if there is any restrictive items. For example, if there is any kind of jewelry, so those things you have to remove, because that might again harm the child. And then during the seizure or before the seizure, whatever signs and symptoms, so whatever signs and symptoms the child is experiencing, and if the child is telling you, you have to note each and every characteristics. Even when the child is having the seizure episode, at that point of time you actually cannot restrain the child, you cannot touch the child. So you have to what you have to do is you have to note the characteristics. So that is very important. So if you know the characteristics of the seizure episode, or the signs and symptoms the child experienced, or the phases the child goes through right before the seizure, that would actually help you to establish a proper care plan for the child. Well, that's all about today's class. So let us conclude our today's topic here. So today we learned about convulsion disorder or epilepsy, which is called as actually seizure disorder, which means abnormal electrical discharge from the brain. So I hope you have got a better insight about the topic. Thank you.